in that healthcare is hyper local.
Absolutely.
It's where you are, and to have all of that dictated in DC is worst case scenario as far as I'm concerned.
Hello and welcome back to the Beards.biz podcast. I'm Anthony Pacheco, your host. Today we have David Balat on with us, and I think I just said his name wrong again. It's Balat.
It works. Balat is just right.
Cool. Well, hey, welcome to the show. Thanks for coming on. So tell us a little bit about yourself so the audience knows who you are.
Yeah, my name is David Balat. I'm a native Texan, originally from Houston, and have been in the healthcare industry since I was a young man. Decided to go the administrative route, became a healthcare executive and eventually a hospital CEO, which I loved and did for nearly 2 decades, and wouldn't trade that experience for the world. And the last part of my career was in turnarounds. So I would go to financially distressed organizations and get them back on their feet, and healthy again. Work with a lot of wonderful people and great communities to get that facility back to running. One thing that I learned being in the C-suite of those kinds of facilities and just being in healthcare in general is that I learned that politicians in DC didn't really understand what healthcare was. And that was one of the big reasons, one of the main reasons that got me to thinking and had me consider going in to run for office myself. And that's what I did in 2017. And so I ran in my hometown of Houston and took some time off to campaign. And that was a wonderful experience. I never thought I'd get to do it. But what's funny is, and you may want to get to this part later, but I had the beard when I worked in the corporate setting. But when my campaign team sat me down, they said, "David, you're going to have to shave the beard if you're going to run for office." And that was a whole conversation, and we can talk about that later if you'd like. But shave the beard, so you'll see a lot of pictures of me online without the facial hair. And what's interesting about that is I lost to a guy with a beard. But a fantastic opportunity. I had the opportunity. I lost in the primary to. It was in a great group of individuals. The gentleman that won the primary was now Dan Crenshaw, who's a wonderful House member. And had the opportunity to go back and decided I didn't want to go in and be a part of what I perceived to be the problem. And so I self-funded my own campaign to teach people about healthcare reform, and I would talk to anybody who'd listen. And that led me to some opportunities that I'm taking part in now.
Awesome. So we are going to jump into that beard thing for a few minutes. And,
sure.
I think it just naturally came up, and we'll just kind of diversify or kind of shift over into that. So you as a person always had a beard, or kind of when did you tell us then that?
I would say I probably started having one, and not always, but probably around 2014, 2015. Grew it out and enjoyed it, kept it, had it for a number of years until I was told that I needed to shave it for my political aspirations.
Sure. And professionally at the time, where were you serving at that point?
I was doing hospital turnarounds. I worked basically for myself. I was self-employed, working as a consultant, going in as a turnaround CEO.
Sure.
So I had the flexibility and autonomy to be able to make that decision for myself.
Now, did you feel, because most of the time when you're dealing with hospital groups, you're dealing with board of directors and investors. Did you ever feel any heat or weight about having to, having the facial hair, or was it kind of the same?
No, in those positions, they needed my services, so it really wasn't a consideration at that point. You took me for me, and that's how I came to the table. So I didn't really give that too much thought. My focus was on getting the job done. Um, and I've seen the responses to your LinkedIn poll, and most people don't care as long as it looks groomed
Sure.
and well kept. And of course, as a professional, you're going to do that.
Right. Just like walking in with a shirt that's, pressed and not all
Yeah.
wrinkled up, or, you got shoes on that aren't falling apart, right?
Or wearing a shirt at all. You don't want to go in topless.
I get some looks, huh?
Absolutely.
So David, did you grow up in Houston?
I did.
You did. So what part of Houston, if you want to kind of expand on that a little bit?
Well, most people in the country will know the area that I lived in. I lived in an area called Meyerland. And if you kept up with Hurricane Harvey, that was the point of origin for all the flooding. And
Sure.
that's one of the reasons I'm no longer in Houston. We had enough of our house getting flooded out.
Yeah, my uncle lived just north of Houston. Is it
Kingwood.
Kingwood, yes.
Yeah, it's a nice area as well. I did some work in that area for a number of physicians.
Okay.
It's a great town. I liked it. It's grown considerably. It's a lot more congested than when I grew up there. A lot of fun things to do. I miss the diversity of food and the arts and just things that come with being in a big city. But I live in the hill country of Texas now, and I'm enjoying the country life.
That's a beautiful area to live.
It really is.
Yeah,
it really is.
I grew up in the North Dallas area up in McKinney.
Yeah.
Well, just north of it, in a little small town called Tom Bean, but Sherman Denison area, and started my practice in McKinney, and so love the rolling hills of the hill countries of Texas. It's just a place to get away and kind of get quiet, and so that's really great. So a little bit more about you and your background. You grew up in Houston, stayed in Houston afterwards. Professional life. When did that start? Kind of take us through that journey.
Oh gosh, I'm a child of immigrants, so I was supposed to be a doctor.
Exactly.
I just wasn't science. I love the sciences. I'm just not a scientist. And working in the hospitals, you got to see the doctors and the nurses and the administrators, and the administrative aspect really just spoke to me. That was where my strengths lied. And so went off to graduate school, got a job in a memorial hospital there in Houston, worked nights, learning the business of healthcare. And that's where it blossomed. From the time I was 15, though, I worked in just about every department a hospital had. I was in lab, pharmacy, was an orderly when that was such a job, in the ER and ICU. And I just loved it. I loved the interaction with the patients and the staff that were helping the patients. That was something that was exciting to me. It was something that was really, I considered it to be something special. And I wanted to be a part of that. And so that's where I went in terms of educating. My education and development was, I wanted to be a hospital CEO. So I did what I needed to do to get to that spot.
Awesome. Why the hospital route? You said family of immigrants. Did you have physician parents? Like what motivated that, or what made you start looking towards the hospital route?
I had my parents were tailors, so we didn't do real well financially, but we had what we needed day to day. But I did have some family members that were physicians that helped me get those jobs, and it was a good way to make some money in the summer. That was just the connection that I had, but it was for some reason I connected with it. I still to this day miss the hospital. I'm one of those weird people that likes the smell and going into the different departments. When I was a CEO, I was my management style was management by walking around, and I would go to the OR and I'd scrub up and suit up and sit there and talk to the staff and meet with my doctors while they were preparing for surgery. That was what I like to do. That's where I like to be.
Yeah, that's awesome. And I think that there's a lot of people that can glean from that, especially from the leadership side. I think, I don't know if you know who Gary Vaynerchuk is, but he kind of talks about the clouds and the dirt. and it takes spending a lot of time in the dirt to understand what it's, what life should be like once you make it up to the clouds. And, I think a lot of time leadership and when you're in charge of a mass group of people, it's hard to be able to make your way around and be around everybody all the time. But our culture sees our leaderships that are involved and the ones that aren't. And the ones that are involved and come in and check in with them and treat them as humans, they will respond with more productivity, more love for their job, a happier lifestyle, better mental health. I mean, all of the just different pieces that come through that. So that really appreciate you doing that.
People like to be acknowledged. They like to be recognized. I'll tell you, a gentleman, I considered him to be a mentor. I don't know if he'll even remember who I am, but his name was Dan Wilford, and he was the CEO of the Memorial System when I was there in Houston. And I was working in one of the business offices of one of his hospitals at the time. And he said, "David, come take a walk with me." And this was the CEO, and I'm the front desk guy, and he knows what my aspirations are. And he would take the time to talk to me about it. But when we were on this walk, the thing that struck me was this: he would stop the housekeeper or the maintenance person, and not only did he know their names, he knew the names of their children. And I thought, I don't even know the names of these people, and I work in the same hospital as them. And it was an incredible lesson for me, because regardless of whether he was naturally gifted at remembering names or not, that's not the point. I think that we as professionals and leaders need to develop that skill so that people feel that there's a sense of investment, the sense of I acknowledge that you're here. I appreciate the work that you do, and you do contribute to a better place. And it's easy to look down on, especially people that clean the place or the upkeep. I remember being in a meeting with MD, PhDs, and all the way down to our housekeepers, and I'd say, everybody here is contributing to the same outcome. And for some that could be offensive, but it's really true, because if I don't have a clean environment, patients are not going to get the best care, because they could get an infection. They could get sick for some other reason because of the lack of cleanliness. If equipment's not working and they're not getting oxygen, there's only so much a doctor can do if he doesn't have the tools that he needs to keep that patient safe and get them a good outcome. So everybody's job is important, and I think it's important as leaders that we remember that and acknowledge people for their part.
Yeah, that's great. That's a value hammer right there. I know our audience is going to really love that. So appreciate you sharing that. That's great insight. Really is. Let's kind of talk a little bit about your transition professionally, right? So,
okay.
Talking a little bit the CEO life and what you're doing there. What are you doing now? What are you up to now?
Couple of things. I'm the director for health policy with the Texas Public Policy Foundation, which is the largest think tank outside of Washington, D.C. A bit of a change in careers, but I'm really enjoying it because I'm getting to modify my skill set in a different way to advocate for solutions on a national basis, and specifically in some of the states where we're very heavily involved. I'm also the executive director of a coalition I started in 2018 called Free to Care, which is a coalition of member organizations that advocate for good policy solutions at the federal level.
Okay. So some of the people that will be listening might not know everything that's going on with healthcare. So they're aware that there's a transparency thing going on. Mm-hmm. They're aware that it is completely unsustainable and out of control cost-wise. So what are you doing directly to kind of change or shift or help the politicians in Washington, D.C. understand what's really going on?
And, believe it or not, we can get more done at the state level. There's
Absolutely.
A lot of gridlock at the federal level. And in some cases, that's not necessarily a bad thing, because the more that they do, the more we have to fix what they do. So I would encourage anybody who's watching, if you want to make a difference when it comes to politics, be as involved as you possibly can at the state level. It's easier to get access. and they want to hear from you. Something else that I say is, it's not just enough that you know who they are. Have them know who you are.
Absolutely.
Have them have your cell phone number and ask whatever your area of expertise is. It's to give you a call. Now, of course, they're gonna want funds and fundraisers and things like that. That's part of the game, but it's important to share your voice and make your voice known in your area of expertise with your representatives. They hear from a lot of folks, but they need to hear from people who are on the ground doing the job, not just the lobbyists and special interest groups. But as far as what we're doing, we are looking at price transparency of hospitals and other medical providers. We are looking at the root causes of why prices are increasing and unsustainable pertaining to drug prices. We're looking at trying to create alternative coverage options that aren't so expensive, because all we've seen over the last 10 years is almost a doubling in terms of premiums, deductibles, coinsurance, maximum out of pockets. And so we want to be able to inject as much creativity, especially for the small employer or the employers, now that many of them are self-funded, so that they can do what's best for their employees. I'm a big believer in that healthcare is hyper local.
Absolutely.
It's where you are, and to have all of that dictated in DC is worst case scenario as far as I'm concerned. So we want to make things as flexible and as customizable as possible, so that you can impact the needs of the people that you're providing these benefits for.
No, absolutely. I think that you hit the nail right on the head there. These big battleship or tankers that, take forever to turn around. And in healthcare, when we're local and we're making decisions at the employee level,
yeah,
you can turn on a dime whenever it need be. I think that's what we really need to start focusing on in our health plans, and especially for the small group marketplace, that under 100, to where they can understand there are options out there. They don't have to take an off-the-shelf product. They don't have to do it the same way that they've done it for years, or get into a situation where they're unable to maximize their profitability or to grow because of their growing healthcare cost.
That's right. Yeah,
Absolutely.
getting involved with an objective third-party administrator, not necessarily any of the big Blue Cross, United, Cigna, Aetna, Humana groups, because they don't really have an incentive to keep costs low for a lot of reasons that would take up this entire show. So we won't get into that right now, but I'm happy to answer any questions of anybody that may have them. They really don't have that incentive. And in fact, I tell people all the time, always ask the cash price, because so much of the time you're going to get a better deal. And if that's the case, if we can get a better discount paying cash, how relevant is health insurance? Because honestly, that's their job. But it's become so bastardized, and it's just not what it was intended to be. It's something different now.
Absolutely. No, that's how I stumbled into the industry, literally negotiating my wife's ER visit. Got it from $2,200 down to $220 by paying cash on the spot.
Yeah.
Easily. It blew me away. I was just like, wait, what?
We have a private Facebook group at our think tank. It's called Right on Healthcare. If you go to Facebook and you go to Right on Healthcare, just ask to join and we'll let you in. But we have a lot of tools, and we have a lot of doctors, and we have a lot of, just anybody. We have a lot of experts in the healthcare field, and they're wonderful about answering questions. I don't know everything, but I've got access to a large group that there's going to be the answer to the question. But we had one couple that was on Medicare, and the husband needed a chemo drug that he was going to take for the rest of his life. Even on Medicare, the cost for that drug, the generic drug, was $500 a month. That's a lot of money for somebody on a fixed income. It's a lot of money. And they didn't have it. She just was very upfront. She says, we don't know what to do. And we thought that Medicare would take care of us, and we didn't expect this. And he has to take it. So we're either going to cut his pills, or he's just going to go every other month. We don't know. We looked. We have some tools as to where you can find some whether it be surgery or doctors or labs or pharmaceuticals or imaging, folks that post their cash prices. And we found an organization, they had the same drug, not an alternative, the same drug, because it was generic. And if the cash price was $50 a month.
Wow.
So same savings that you received, a 90% discount. That was life-changing.
Absolutely.
And they weren't getting any help from anybody else as to, look, you can find a better deal somewhere else, because many people don't know. But that's part of what we do is we're shedding some light on the fact that, healthcare doesn't have to be affordable, or it doesn't have to be expensive. And in fact, it is affordable if you know where to look.
Sure. Absolutely. I mean, it's the same thing. I always said the same question. I always ask the same question. Do you let your employees make the largest financial decision of the year in less than 30 minutes, which is typically how an open enrollment works, right?
Right.
Open enrollment meeting, here's the presentation, make your, have your stuff back in by the end of the day, right?
Yeah.
Like very few are
Right.
making these huge financial decisions. I mean, people are paying $10,000, $15,000, $20,000 a year just in premiums, not to mention out-of-pocket expense.
Well, and not to mention the employers.
Right.
And oftentimes it's the number 2 line item.
Absolutely.
And, many people, if not all of people, they didn't get into business to become a healthcare company.
Mm-hmm.
And that's what you are. If you're spending that kind of money, you're spending
Like it or
money on
not.
health.
Yeah.
Like it or not, that's the case. And there are solutions out there, and a lot of employers now are getting to where they're identifying some creative solutions that is not only more affordable, but creating more value for their employees, and increasing their ability to recruit, increasing their ability to retain, and getting a better outcome.
Absolutely. And the employees have a better experience, right?
Oh, without question.
Yeah.
And in some cases, I'll tell you, there's a big restaurant chain here in Texas. I was testifying before a House committee, and he was sitting right next to me. And I didn't know that's who it was. I eat there often, so I was happy to get to know him. Hasn't resulted in any discounts, so it didn't bear much fruit. But what he said was really quite amazing. He's got a ton of employees, and he's always offered health insurance. That's important to him. He wanted to take care of his people, and he had one of the big insurers. So, but what he did is he kept he got a very high deductible option with the insurer, but then he incorporated something called direct primary care.
Mm-hmm.
And he pays a monthly subscription for his employees to go see this physician that is incentivized and reimbursed to provide healthcare, not sick care the way we understand it, because now healthcare in the traditional sense is very reactive, not proactive. So this was a proactive component of the benefit plan. He also negotiated with some surgery centers that were cash-based. They were third-party free, so they didn't deal with insurance companies. Their prices were so low as compared to the facilities that took the insurance company. They were anywhere from 10 to 30% of what the price would be at the facilities through the insurance companies. And great outcomes. This wasn't bargain basement, low quality care. This was great quality care, but they don't have all of that expense of having to collect from the insurance company. If you went to that facility, you didn't have to pay your deductible as an employee, because when you're self-funded, you're the insurance company.
Of course. So
they got to save the money on the deductible, and in some cases, if it was a big enough procedure, if they chose to go to that surgery center, there would be $1,000 incentive bonus for them to go there, and he would cover travel and housing if it wasn't in the town where his business was, or one of his chain restaurants were.
And that's life-changing, right? Life-changing for the employee.
Absolutely.
Who probably, the average American has less than $1,000 in their checking account at any given time. What does it say? 80% of Americans have less than $1,000 in their checking account at any given time.
60 to 80%.
Right. And so there's no way that they could, come up with their out-of-pocket expense for procedures right? So it's going to go on a payment plan, which means that administration is going to have to pay more money to go collect that money back from the patient for their out-of-pocket expense, plus, the money that they're spending to get their reimbursement from the insurance company.
Yeah. And in that particular example, not only did the patient not have to pay, they put $1,000 in their pocket.
Sure. To recover,
So yes,
time off from work.
life-changing.
I mean, all of those different pieces, right?
Absolutely.
Yeah, that's great. Thank you so much for sharing that. Absolutely. So we talked a little bit about the beard. We're going to jump into that section of it right now. And
All right.
so I'm very interested in this campaign piece. You had the beard, you came in, they're like, what was their reasoning for telling you couldn't have the beard?
That was interesting. They said at the end of our introductory meeting, they said, okay, now that you're in, or this was the second meeting where I said, okay, I want to do this. They said, you're going to have to shave the beard. I said, no, that's not something that we're going to do. They said, look, if you're serious and you want to do this and you want to have a shot at winning, the polling says that people feel that if you have a beard, those are people generally that have something to hide, and they like people that are clean shaven. I said, well, I'm not happy about it, but I'm going to go ahead and do it. So we did shave, but as soon as the primary was over and there were winners and I wasn't one of them, my wife told me to lose my razor.
So that's interesting. So the wife loves the beard, huh?
Oh yeah.
That's awesome. My wife actually encouraged me to grow mine out. I didn't have any facial hair, and then COVID hit and I just didn't shave for like a week. And I was watching, all these Zoom calls that kept going back and forth. I mean, I was watching and they're like, everybody's starting to not shave and be just fine with it. And, I started growing out. My wife's like, you should grow it out. And I was like, I don't know how it'll grow in. So this is the result of 1 year of not shaving. Well, not shaving, but, it's been trimmed up quite a few times. But
yeah, well done, sir.
Oh, well, appreciate it. Yeah, it's very interesting. So they thought that the polling showed them that people with facial hair had something to hide. I think that's very interesting.
Yeah. You're more trusted if you're clean shaven. I don't know that that's the case anymore, and I would tend to think that would be something that is regional. But like I said before, the guy that ended up winning had a beard. So
had a beard. Yeah.
So much for that polling.
Right. And it's funny because I was actually told the other day that the beard actually is a trusted thing. It's something that means trust. And I don't know if that's a new thing that's kind of trended. And I was surprised to hear it too, because I have always felt that way. It came from the hospitality industry, managing private country clubs in North Dallas. You didn't have facial hair. Like, it was a clean shave every day.
That's right. Yeah.
And so it's just all been very interesting. So I really appreciate you sharing that story with us.
It's my pleasure.
So you said wife, any kids or anything?
Yeah, 2 children. I've got a 22-year-old daughter and an almost 21-year-old son.
Nice. And then how long have you and your bride been married?
Tomorrow will be 25 years.
25 years. Congratulations.
Thank you.
Yeah, absolutely. That's always great to hear. So, hey, we really appreciate you being on the show today. Is there anything else that you have going on that you'd like to make us aware of? We're going to put your Facebook group in the show notes. If there's anything else that's going on, if you need support, we can put your links in there as well. Any campaigns or anything that you have coming up?
We're working on starting a book right now. More information on that as time goes on. But you can really find what I'm up to and what I'm passionate about on my Twitter handle, which is David Balat HC for healthcare. And I'm pretty active on that. And if you want to get a hold of me, that's a good way to do it as well.
Absolutely. We have seen many tweets from you, and we will continue to see many tweets going forward, because I do not think that healthcare is going to change overnight. And so we appreciate your service and everything you're doing to help push that forward. Keep up the good fight, and appreciate you coming on.
It's my pleasure. Thank you for having me.
Absolutely. Have a good day. As we end today's episode, I wanted to show my gratitude to all our listeners for your support and reviews. You took the extra 30 to 90 seconds of your day to show love and why this is worthwhile to watch. Thank you so much, and we'll see you next week.